Welcome, our viewers. Today, we have a special guest, Dr. Adrian Valdivia Hurricane. He is an amazing teacher. I've seen him giving talks. I've seen him teaching to residents. Dr. Valdivia is an incoming associate program director for neurology program. He's a neurologist, trained, board certified in neurology and neurocritical care. Welcome to our channel, Dr. Valdivia.
A pleasure to be here. Thank you for the opportunity. Looking forward to this time with you.
Absolutely. I've seen you giving talks to residents how to do an effective clinical presentation. Tell us the background of today's talk, Dr. Valdivia.
You know, the issue was we are used to writing the notes in this SOAP format. The progress note goes from the subjective, objective, assessment, and plan. And that is embedded in our culture. But there was also something missing when the residents or the students were going to present the case. There was something that wasn't holding the system together. So I then proposed the Super SOAPPE note, which I would love to share with you what that is, and hear your comments as well as hear your audience comments to see what they think about it, and love to get some productive, effective feedback.
I cannot wait, Dr. Valdivia. So by all means, please go ahead and share your slides and tell us about it. One.
So the Super SOAPPE is a method, a technique of effective clinical rounds presentation. Your next day, you're going to round with a team, and how are you going to present that case effectively? So be ready to present the case. You have pre-rounded on your patients, but you want to present in a structured, elegant, reproducible, and yet effective fashion so that you look good, the team looks good, and everybody is in tune with what you're saying. So we're familiar with the writing of the progress notes in the usual familiar SOAP format. So leveraging on the SOAP format, then comes the Super SOAPPE note, and the Super SOAPPE note has these elements of the summary of the case, the subjective element, the objective, the assessment and plan, and then the expectations, and lastly, the bibliography. And it is that last element, the bibliography, where the student, the resident went to the bibliography, to the PubMed or Google Scholar, and they were able to find something recent, relevant, applicable to the case, and then they can briefly discuss that. And then that holds everything together. So what would something like this look like? Well, for example, Mrs. Jones is a 60-year-old who is now in her third hospital day in the first day post-op. She's here due to diffuse ascending acute bilateral weakness, and we think it is AIDP. She has received her second IVIG dose. Subjective then, here you include any subjective elements. So just like usual you have done, the patient had bowel movements, the patient slept well last night, some subjective elements that the family or the nurse will volunteer so that you can include that in the discussion. And then you move on to the objective components. The vital signs are, and the pertinent elements of the exam, and you're going to include the pertinent negatives and positives. The lab test, the results of the consultation, the results of the last chest x-ray, and what recommendations the consultants have left. Then you generate the assessment and plan, presented, you itemize it, and that includes a differential diagnosis. I always suggest to provide 3 elements of the differential diagnosis. If you're between 3 and 5, you're in good standing. Really, you don't have to generate 10, 20 elements of the differential diagnosis to show that you are where you need to be. My top 3 differential diagnoses are A, B, C, and D. And then continue to discuss what medications or procedures you plan to do, and what education the patient and the family may need, and what consultations or appointments or follow-ups the patient will need. That's all part of your assessment and plan. And then you know about the expectations and you can share that with the team. We want to know the expectations for multiple reasons. One is, if we want to meet the expectations so that we can say this patient is satisfied with our care, then we need to know the expectations so that we can meet them. If we meet the expectation, the patient is satisfied. But on the other hand, we could say we want to exceed their expectations. And that is how we create loyal patients and families, by knowing the expectations and be able to exceed them. You also want to present what your expectations are, trying to balance the expectations from the family and the expectations that you and the team may have. So hence the importance of knowing what the expectations are. And lastly, you pull out a recent publication and say, I read this article that endorses my plan, or this is what's coming into the future. And you give 4, 5, 6 lines about it. And then you close your presentation, and then you look good. Your team looks good. The patient looks good. And you have succeeded. So the Super SOAP therefore includes the summary of the case, the subjective aspects, objective assessment and plan, the expectations, and the bibliography that endorses that case that day.
This is fantastic, Dr. Valdivia. I truly loved it. I especially two components, which usually we miss out in training, or when we were trained, the expectations of the family, expectations of the patients, and try to meet them. And then, of course, the bibliography part, that means you're up to date, current with the current literature as well. So what prompted you to bring these components as well? Of course, people do it invariably, but you're providing a checklist for everybody to be excelling in these things. So what was your prompt for this to bring in as expectation part and make it this kind of checklist?
I felt there was a vacuum, a little bit of a disconnect between the note and the presentation. And I always noted frequent hesitations on how to get the presentation going, how to finalize it, what to say after the assessment and plan. And since it is a checklist, you will be more likely to do it on a consistent basis. And there will be less variability from presentation to presentation. So even if you have to present 4 or 5 cases, you have a method, you have a checklist, you have a plan. And in the same way that SOAP note is already ingrained, something like this, or this very thing can also gradually be implemented as a method that is practical and effective to use.
Absolutely. So our viewers, those are listening, if you're a medical student, if you're a US medical graduate or international medical graduate who's submitting your rank list or planning to approve, please watch this, follow it, to make it part of your practice now. So when you come as a resident, you're already becoming a favorite resident for your faculty member, like Dr. Valdivia, or family members. In most importantly, you're creating a value to the patients. They will be satisfied. Remember, this is the toughest day in their life if they have to be in ICU, neuro ICU, or in hospital for that matter. Dr. Valdivia, thank you so much for coming together with us today and having it recorded. We will like our viewers to write a comment, like it, subscribe it, and then we hope to bring you back again for similar pearls of wisdom from your practice.
Well, thank you so much for having me.
Absolutely.